Hey, this is Chad Campbell, Certified Functional Medicine Provider with Redesign You and Hope Family Care. And I'm back in the office, back doing my part with this COVID and seeing patients. And I've had a lot of people asking me about the vaccines and to do a video on vaccines. And to be truthful, I've been putting it off. But we're going to do this. We're going to do this tonight. I'm going to tell you what I think. I'm going to tell you what I feel. And I hope this helps somebody with their decision. As an update, my family is doing amazing. Nobody's having any complications. Everybody's doing great. We thank you for all of your prayers and all the comments. And I just ask you guys, please just keep sending comments and let's keep this whole thing going because we are each other's support going through this. If I look tired, it's because it is 9:30 and I just got done with clinic. But I've had so many people today asking me to do one on this that I wanted to make sure to try to get it out there to you as soon as possible. So let's kind of start from the beginning around about this round two of this pandemic that we're going through. And I don't want to bore people with all of the stuff that you hear about all of the time. Again, I just want to bring the facts so we can live off of the facts over the fear, and then we can make our decisions based off of that. So I heard some statistics that were kind of scary, or they're scary. Yeah, they're kind of scary that I hadn't known. And that those people that get discharged from the hospital, they have a 6 times increased risk not to be alive in 2 months over the other population. 6 times. And 10% of those who do get discharged from the hospital die within 2 months, and 15% are back in the hospital. And so what this means to me is that, just because somebody gets COVID, they go into the hospital, may get some treatment, or they go to their primary care and they get treatment, and then they start getting better, does not mean this is over. Okay, remember, we're going to talk about the complications in a little bit, but again, we're going 2-3 months out here on what we're watching for with these possible complications. So stay with the support of your family. Keep checking in on the loved ones that had this, and we have to keep monitoring each other. Well, I do have to say one thing after I did get this COVID and I do believe it was from a really nasty sick clinic that we had, where we had a lot of nasty COVID patients. Part of this, my cognitive processing is still like trying to catch up. And it's so weird. Like, I know what I want to say, but sometimes it just takes me a little bit to get it out there. So if you notice that, be patient with me. It is getting better each day, but it is something that I noticed that that I'm actually still doing even after 4 weeks out now. Still going through this pandemic. It's all over the place. We hear about this new strands which are showing up. Nobody knows anything about this. Keep waiting, and I will bring it to you as soon as we know something about it. But for the viruses that we have in our area right now, the incubation period is still the same. So what that means is that from the day of onset that you were exposed to the day of onset of symptoms can be from day 2 all the way to 14 days after exposure. And so what that means is you can get sick anytime during that time. And they're trying to say that 50% of people are asymptomatic who actually have it. But does that mean that they can transmit the virus? Nobody knows. Are they contagious? I have no idea because they're asymptomatic. So nobody can really give us a good thing of that. But from the time of exposure, you can have symptoms all the way from day 2 all the way to day 14. Okay, so what that means is when we get into the testing is you can test on day 5 and be negative, but still test on day 6 and be positive. And so it gets really confusing and gets frustrating when you're trying to help people to get back to work and to help people to understand what's actually happening. Currently, the guidelines right now with exposure from the CDC is 7 days of quarantine from exposure, and on day 8, testing. And if you're negative, you're good to go back. Or 10 days quarantine with no test. Now, around us, there are multiple employers and state organizations which are like doing weird stuff as far as their return back to work. But what I just said, 7 days and on day 8 with a negative test, or 10 days of quarantine with no test, that's what the current CDC guideline is as far as the quarantine from an exposure. So let's say you do get the virus. Week 1 is a virus. It's a cold. It's still the same thing. People ask, what are the symptoms of COVID? And I tell them, pick a symptom. It's anything. It's anything at all. A headache, a runny nose. We mostly see, and I mean more than 70% of the people that test positive in our office are just having sinus or allergy symptoms. It's not shortness of breath or deep chest symptoms. It is sinus issues. The 2 common symptoms that everybody seems to have is excessive fatigue and body aches. Those tend to be the 2 symptoms that most all people have. But the most presentation that people have is the sinus stuff. So that first week, remember, it's just a cold. It's a virus, and it should pretty much act like any virus does. Then between week 2 and 3, now we're starting to watch for all these complications to start to hit. So if you've had a virus for the first week, and then after week 1, now you're starting to feel like, man, I'm really getting worse from this. There's like, I'm not feeling better like I would normally do off of a virus. Now we start thinking, all right, is there a secondary bacterial infection? Is there some type of progression of the inflammatory response that's happening in your body, where you've heard people talk about cytokine storm? That's a big issue with those lungs. Or are you throwing clots? Are you throwing clots to your heart, to your brain, to your lungs? Those are going to be signs of that you're starting to feel like you're getting worse. We don't want to use steroids in that first week if we don't have to, because of the increased risk of steroids causing fungal infections. And so if during that first week, you're an asthmatic, a COPD, and we just had to put you on steroids during that time, and you're starting to get worse, we now have to rule out secondary bacterial, but also secondary fungal infections. So those are the things that you're thinking about week 2, week 3, week 4, if the symptoms are progressively getting worse. And these are the times where we start drawing blood, and there are certain lab draws that we can do to know, to give us an idea if you are going to decompensate, meaning you're going to start getting very sick very quickly, or if you have this large inflammatory response happening, or if you're throwing clots. And so that's why you want to stay very close contact with whoever's taking care of you as far as your primary care, and use your support of your family or your friends so that they can help get in contact with those people if it seems like it needs to, or that you need to get in with them. Testing, rapid testing versus the deep in the nose testing versus all of these other types of testing that you're hearing about. So out of all these testings, it's still the deep PCR nasopharyngeal swab that we stick way back up in there is still going to be the most accurate that there is. Now, granted, it's still not completely accurate, but it's still the most accurate. The rapid testing for my clinic and the research that I have done is that we will only do a rapid test if you are sick. So you have to be sick because you have to have a large amount of that viral load. And when you, like I said in the beginning, is that the testing, that PCR, that deep nasopharyngeal swab, can start to turn positive 2 days before your symptoms start. Not a rapid, the deep nasopharyngeal swab can become positive 2 days before the symptoms start. And then it starts to decline after day 5 of your symptoms. So it's going to be less accurate from day 6 on. And this gets hard because you can start developing symptoms anywhere from day 2 to 14 after your exposure. So again, the deep nasopharyngeal swab can start to turn positive about 2 days before your symptoms start and starts to decline day 6 after your symptoms start. And then it starts to decline after that. For the rapid, it is most accurate when you are at your sickest, when the viral load is the highest, because it's not as sensitive as the deep nasopharyngeal swab is. So for us, you have to be sick. And it's best if it's done between day 2 or 3 to day 7 of being sick. That's where the rapid is going to be the most accurate. So that's how you know, like, which is going to be the better one to try to think of as far as the testing that you're going to do. Vaccines. First thing to remember, this vaccine is not an approved vaccine. It is not FDA approved. It is granted emergency use for COVID-19, SARS-CoV-2. This is not to say people should not get this vaccine, okay? The thing that we have to remember is that this is not approved FDA vaccine. It's used for emergency use in order to try to reduce the amount of deaths that's happening in this country from COVID-19. The vaccine this is what we have been given, okay? Because we're getting a lot of phone calls, who should get the vaccine, who should get the vaccine. So this is their phases. Phase one was for first responders, fire, police, medical people. The next next is going to be for essential workers. Essential workers, including correction officers, food and agricultural workers, postal service workers, manufacturing workers, grocery store workers, public transit workers, and those who work in educational sector, such as teachers, support staff, and daycare workers, and people over age 75. No, we do not make these. This is what has been given to us. Phase C, people age 65 to 74. People age 16 to 64 with underlying medical conditions, which increase the risk of serious life-threatening complications of COVID-19, and other essential workers who work in transportation, food services, housing, construction, and finance, information technology, communications, energy, law, media, public safety, and public health. When these vaccines were given, these are the regulations that we have to follow. So that's how you know where you fit into that. And these vaccines were given to us, and we have to distribute them the way that they were given, the way that we were told to give them to us. As far as the profile, the safety of this, I'm going to be 100% honest, and I don't know if I'm going to get turned off on this on YouTube or Facebook or whatever. I don't know. I don't know. I don't know what the right answer is, because there is not enough safety profile for me to be able to give you a good, educated decision on the vaccine. I do alternative vaccine schedules for kids. I am research these vaccines on what's the most important, the possible side effects, the way they're made, all of that stuff. And I don't know what to tell you. They say that it is very safe. You'll hear about people developing neuromuscular disorders or Bell's palsy. That is common. When people get the flu, they can get Bell's palsy. When they get the flu vaccine, they can get Bell's palsy. When people get COVID-19, they can get Bell's palsy. So when they get the vaccine, they may get Bell's palsy. I don't know if there's any increased risk with the vaccine versus COVID with Bell's palsy, but there's not with the flu. With The other neuromuscular Guillain-Barré, we don't know. I have no idea. People are having some minor reactions to the vaccine as far as the redness at the site or fevers. Are they going to develop the virus? Most likely not develop the virus from the vaccine. Can they still get the virus after the vaccine? Maybe. And it should be a much milder form. But again, we don't know yet. Right? How long will the vaccine work? Don't know. Because remember, when you get COVID, 3 out of 5 have antibodies at month 3, and then only 1 out past that up to month 6. So we're not keeping the immunity after we get it. How long will the vaccine last? Don't know. Don't know. Because it's not FDA approved, it's emergency granted access. And so we'll have to see. So the right answer for this, for me, to give an educated answer is, I don't know. For pregnancy, the guidelines right now for pregnancy is it hasn't been studied. So I can't say it's safe for pregnancy because it hasn't been studied yet. Their recommendation is, as a pregnant mom, you make the decision if you feel you should get it or not. But they don't know what the possible complications are. I've heard people talking about sterilization and giving the vaccine with the vaccine, but everybody should know one of the complications of getting COVID-19, as far as a male goes, is many males are developing erectile dysfunction. They can't get erections anymore when they get COVID-19. So that's another one. Is it going to happen with the vaccine as well? I don't know, but I know it already happens with the virus. So again, facts, no assumptions, not Chad's opinion. These are the facts. And unfortunately, I can't make this decision for you because I don't have enough research and facts to tell you it's going to be safe or to tell you stay away from it. The thing I can tell you is this: from all of my exposures with COVID, dealing with the many people getting sick, dealing with people who have lost loved ones to COVID, the deaths that's happening around us from COVID, it's always easy to get COVID and then to be better like I am and say, see, I didn't need that virus. I didn't need that vaccine. I got over it on my own. But it's not so easy when somebody dies from it and then say, well, I should have got that vaccine. I should have got it. So for me, what I am telling people is we have to weigh the risk versus the unknown benefit of the vaccine. So the risk being, how at risk are you? Do you have diabetes? Are you really overweight? Are you immunocompromised? Do you have a recent history of cancers? Do you have horrible lung disease? Do you have horrible heart disease? Because though there are exceptions, those are the ones that it tends to be having the most problems. And if you are one of those, you need to really consider the vaccine. But you have to understand we don't know the long-term effects. We wear our masks, we try to protect our loved ones, washing our hands, and we do our best. And we see how long this thing is going to last. Until then, what do we do? I have to say, so I'm sorry for those who want me to give you a definite, but I wouldn't give you a definite unless I have it. But those are the facts. So make your decision. What do we do until then? I highly recommend the supplements that I take for this, as well as that I have recommended for my father-in-law, the one with the severe heart disease that he takes, that my mother-in-law takes, that I recommend to my patients during this, and that is going to be the vitamin D every day with a meal, the B complex with a methylated form of B12 every day, the zinc 15 to 30 milligrams every day, the NAC in acetylcysteine every day, 600 to 900 milligrams every day, good sleep, good rest, good diet, That's what we got. That's all we got. If something new pops out with a supplement wise or something to help us, I'll let you know. Vitamin C helps when you're sick. It's not necessarily, see that thing? It's not necessarily something which is going to help prevent, but it is something that helps when you have it. So take your daily walks, get your exercise, do your breathing exercise and those supplements, and just be safe. Please send comments. Let's get this comments going. We are each other's support here. Please interact with me as much as we can. And you never know, we're going to help somebody. I had a patient the other day that told me thank you and to thank my father-in-law for doing the video with him while he was going through his thing, because there's their older family members started with it and they did that and they got much better and they didn't develop the complications. And so they're very thankful for that. So please, let's do the comments together and I will try to respond to as many as I can, and please keep on sending them to me. Okay? Facts over fear, and I'll see you soon. Thanks.